All right, diving right in today, we're tackling acute appendicitis.
Oh yeah, this one is a pretty important one.
It is, it is. It's the top reason for emergency abdominal surgery for both kids and adults, which I found surprising.
Yeah, very common.
So your mission, if you choose to accept it, is to,
I will.
I think you will
Fix
too,
it.
is to really get a grasp on what acute appendicitis is. And we're going to do it fast, right? We're just looking at medical summaries,
The
definitions.
essentials, the need to know stuff.
Exactly. So let's start with the basics. What is appendicitis?
So appendicitis is basically the inflammation of the appendix. As you may know, the appendix is that little finger-shaped pouch that's attached to your colon, and when that gets inflamed, well, that's appendicitis.
Okay, so we hear uncomplicated and complicated appendicitis.
Ah.
What's the difference?
Yeah, so uncomplicated appendicitis is basically just inflammation, like we said,
Mhm.
but there's no rupture, there's no abscess, nothing like that, just inflammation. Complicated appendicitis is when you have those additional problems, like the appendix might have ruptured, you might have an abscess, gangrene, stuff like that.
Gotcha. So how common is this? What are the chances that...
It's actually more common than you might think.
Oh, really?
Yeah, the lifetime risk of developing appendicitis is about 8%. So not, a guarantee, but still it's the most common cause of emergency abdominal surgery. And it tends to peak in the 10 to 19 age group.
Oh, wow.
Yeah, a little bit more common in males, but,
Okay.
just by a bit. From the U.S. data, at least.
So what actually causes this inflammation? Like, what's the trigger?
The root of it all is usually an obstruction in the appendix. Basically,
Oh.
something's blocking the inside that little pouch.
And what kinds of things can cause that blockage?
Well, it really depends on who we're talking about. In kids and young adults, the most common culprit is an overgrowth of lymphoid tissue, which, believe it or not, accounts for about 60% of cases.
Interesting. What about in adults? Is it the same?
In adults, it shifts a bit.
Mm.
Hardened stool, called a fecalith, or just slow-moving stool, is more often the problem. That's about 35% of adult cases.
Okay.
And less frequently, you might see tumors, which are more likely in folks over 50, or even parasites like pinworms.
Parasites.
Yeah, sometimes.
Yeah.
There are a couple of usual suspects there, like anaerobius formicularis, Ascaris lumbricoides, the classics.
Wow. So it's not always just like something you ate, like a seed or something. It's a lot
Well,
more
it's a bit more complex than that.
complex than that. Okay. So walk me through what happens once there's a blockage. What's going on inside?
Okay, so picture this. The appendix is like a one-way street, and it suddenly hits a dead end because of the blockage.
Mhm.
All that mucus the appendix normally produces, it gets trapped, and bacteria start having a field day.
Oh, wow.
Yeah, not good. So that leads to inflammation, the appendix starts to swell, pressure builds up, and the blood supply gets choked off. No blood, no oxygen, and that's when things can get really serious, like gangrene setting in, and then potentially even rupture. And if it bursts, the infection can spill out into the abdomen, leading to peritonitis, which is a whole other level of bad news.
That's pretty serious. So what are the telltale signs of appendicitis? What should we be looking out for?
Well, the classic progression is the story the pain tells. It usually starts around the belly button, kind of vague in general. Then within about, say, 12 to 24 hours, it shifts and settles in the lower right side, becoming much sharper and more localized.
So the pain kind of migrates.
Exactly. The initial belly button pain is from the inside lining of the appendix getting irritated, while the focused pain in the lower right is from the inflammation spreading to the outer lining. The whole process usually unfolds over about 48 hours from the first twinge of pain.
Interesting. So are there any other symptoms that typically accompany this shifting pain?
Oh, absolutely. Loss of appetite is a big one. Most people with appendicitis just don't feel like eating. Then there's the nausea, the vomiting, the usual suspects when something's not right in the gut.
Mm.
And a low-grade fever might also develop. There's even a saying in medicine, if a person with abdominal pain still wants a hamburger, it's probably not appendicitis.
The hamburger sign.
Exactly.
I like it. All right, so let's say someone goes to the doctor with these symptoms. What kind of physical exam findings would point towards appendicitis?
Well, doctors will check for tenderness at a specific spot in the lower right abdomen called McBurney's point, right around where the appendix is located.
Okay.
They'll also feel for any guarding or rigidity in the muscles around that area, a sign that the body's trying to protect that inflamed spot.
Makes sense.
And then there's rebound tenderness, where the pain actually intensifies when the doctor presses down on the abdomen and then quickly releases the pressure. Yeah, not a pleasant experience. And then there are a couple of other signs, like Rovsing's sign, where pressing on the left side of the abdomen causes pain on the right side, and Psoas sign, where pain flares up when you try to extend your right hip.
So once appendicitis is suspected, what are the first steps that doctors will take?
Well, the initial focus is on assessment, figuring out how likely it is that we're dealing with appendicitis. That involves considering the symptoms, the physical exam findings, and sometimes even using scoring systems like the AR score or the Alvarado score.
So it sounds like there's not like one definitive test.
Not always, no.
Okay,
It's often a combination of factors. They'll also likely start an IV for fluids and medications, and of course provide some pain relief. Got to make the patient comfortable.
absolutely. So based on the likelihood of appendicitis, what are the potential treatment paths?
So if the probability is low, they might hold off on further testing and consider other possible causes for the symptoms. If it's in the moderate range, they'll probably want to get some imaging done, like an ultrasound or a CT scan, to get a better look. And if it seems highly likely, surgery to remove the appendix, called an appendectomy, is usually the next step.
So is surgery the only way to diagnose appendicitis, or can it be confirmed without going under the knife?
Well, in most cases, the diagnosis is made based on the clinical presentation, the symptoms and physical exam findings.
Okay.
Blood tests can help by showing signs of infection, and imaging plays a huge role. Ultrasound is often the first choice, especially for kids and pregnant women, because it's non-invasive and doesn't use radiation. But a CT scan can provide more detailed images and might be preferred in adults, or if the ultrasound isn't conclusive.
So it's a judgment call based on the individual situation.
Exactly.
And once the diagnosis is confirmed, what's the typical treatment?
The standard treatment for appendicitis is surgical removal of the appendix, an appendectomy. For uncomplicated cases, it's usually done within 24 hours. If there are complications, like a rupture, then it becomes an emergency surgery.
I see. And are antibiotics typically used as well?
Yes, antibiotics are given in all cases to help fight the infection.
Okay, so what happens in those situations where things aren't so straightforward, like if there's a mass or an abscess complicating the picture?
In those more complex situations, they might opt for a non-operative approach initially, which means using antibiotics to try to control the infection and potentially draining any abscesses. Then, once the inflammation has calmed down, they might perform an appendectomy later on, kind of like a delayed approach.
So a two-pronged attack.
Yeah, exactly.
Are there any special considerations when it comes to diagnosing appendicitis in different populations, like children, pregnant women, or older adults?
Yeah, there are definitely some nuances to be aware of. In children, the symptoms can be a bit more vague and harder to pin down, which can make the diagnosis trickier. And in pregnant women, the growing uterus can push the appendix upwards, so the pain might be felt higher up in the abdomen than usual.
Oh, wow.
And in older adults, they might not experience the classic symptoms as intensely, which can sometimes lead to delays in diagnosis.
So it sounds like age and other factors can really influence how appendicitis presents itself.
Definitely.
So as we wrap up our deep dive into appendicitis, what are the key takeaways you want our listeners to remember?
The most important thing is to understand that acute appendicitis is a relatively common but potentially serious condition that requires prompt medical attention. The classic presentation is pain that starts around the belly button and migrates to the lower right abdomen. But remember, symptoms can vary, especially in different age groups and with other underlying conditions. If you suspect appendicitis, don't hesitate to seek medical help.
Great advice. And on that note, a final thought for our listeners to ponder. Given the advancements we're seeing in non-operative management, what might the future hold for the treatment of appendicitis? Could we see a shift away from surgery in the years to come? Something to think about. Thanks for joining us on this deep dive into appendicitis.
My pleasure.